Affordable Care Act and what it means and does for people, confidence in its implementation, confidence in the humility that we have to listen to other ideas if they have in their replace something that is that works, that gets results, then we shouldn't be opposed to that. But springing from not reducing benefits for people, not reducing the number of people who have access to care. This is about increasing access, improving benefits, and lowering cost. And that's sort of how our conversation went.
Deputy Stabenow, and one last question.
Well, it's important to stress the fact that smoke and mirrors are not going to do it for the Republicans because this has real consequences. Today, in 11 different states, rural hospitals are speaking out against the repeal of health care that is in this proposal. Tomorrow in Michigan, cancer doctors that work with children are going to be speaking out at the state capitol about what this means when we put caps on cancer treatment for children, when we say that they now have a pre-existing condition, or that the essential benefit package that we developed to make sure basic services were covered is turned away. So this is very real. We're not making up anything. This is happening across the country. We are going to be going state to state, community to community, working with people, whether it's hospitals in rural or urban areas, doctors, families, children, nurses, everybody who knows that this is real. It's 1/6 of the economy, and they're pulling the string that's going to unravel the whole system.
I just
Go ahead, Nancy.
Bobby to say something about Representative Virginia.
Thank you. When you say repeal and replace, the only thing that's guaranteed is the repeal part. If there were a bona fide replacement, as it's already been said, we'd have seen what it looked like. The Affordable Care Act cured a lot of problems. It didn't cure all of the problems, but there's a difference between not curing the problem and causing the problem. One of the things that the replacement has got to do, and the reason they're going to have trouble is when they come up with replacements, they're going to have to show how it will improve things they've been complaining about. And the fact is that if you're going to have a pre-existing condition insured not at the standard rate, you have to have some mechanism to ensure that everybody is covered. You have universal coverage. If you can wait till you get sick before you buy insurance, then people will wait until they get sick until they buy insurance. And New York State showed exactly what happens when that happens, because they had guaranteed issue without mandatory insurance. When the Affordable Care Act came in, what did the cost go down? About 50%?
Yeah, we've had great success.
That's what you get when you don't have it. So when the replacement comes, and we knew what it would look like, and it's kind of hard to criticize an invisible plan, we will know how it will address the things that they're talking about. We didn't cause the problems they're complaining about, and they have a responsibility when they come up with a replacement. They'll have to show how they're going to solve all of these things they've been.
Senator Schumer, there are 20 million people who have health care now who didn't before this law was passed. If Republicans repeal it and they lose their coverage, what are you going to say to them? Are you going to say, no, we're not going to help Republicans replace this?
No, we're going to say, let's see the Republican plan, because the Republicans, if we put forward a plan first, they'd reject it. The kinds of things we want to do are quite different. And we want to cover these 20 million. We did already. The problem is, as was said by Frank Pallone, they're an ideological caucus. And they want to repeal it and then try to hang it on us. Not going to happen. It's their responsibility, plain and simple. And let me tell you, you talk to people in the reddest of states. They're the states that are most affected, not only by the rural hospitals, but you take Joe Manchin was on Morning Joe this morning talking about how West Virginia benefits from many of the good provisions in the ACA. And his view is the view of all of us. Let them show us what their proposal is. Otherwise, stick with what we have.
Mr. Schumer, would you comment on Donald Trump's tweet this
I'll
morning?
just say one more thing in terms of that. There is an integrity, a oneness about this. It was about, as I said, lowering costs, improving benefits, and increasing access, but it was a market-oriented solution. So when they throw this apple of discord or this disarray into the system, it's going to have market consequences that they're not thinking of. They don't really care that much about the 20 million who are additionally insured, although they should because they don't like subsidies. But the fact is that 75% of the American people get their benefits in the workplace, have lower premiums and more benefits than they would have without the Affordable Care Act, and the Republicans do care about that.
Thank
So
you.
we'll see where they go.
Thanks,
Thank you.
everybody.
C-SPAN's Washington Journal, live every day with news and policy issues that impact you. And coming up Thursday morning, Congressman Jared Polis will be on. He'll discuss his new role in the House Democratic leadership and his party's priorities for the 115th Congress as it gets underway. And then Ways and Means Committee member Tom Reed, who endorsed President-elect Trump early in the 2016 election, will talk about the House Republican agenda and how members plan to work with the new president. Also tax and fiscal policy and changes that House Republicans would like to make. Be sure to watch C-SPAN's Washington Journal beginning live at 7 Eastern Thursday morning. Join the discussion.
Tomorrow, a hearing on cyber threats against the U.S. with testimony from National Intelligence Director James Clapper and NSA Director Mike Rogers. They'll talk about Russia's